Let's talk about the somatoform disorder. This is almost equivalent to something called MUS, medically unexplained symptoms. So those are disorders which does not have an organic cause, that is somatoform disorder. There are many variants. One of them is somatoform autonomic dysfunction, which can involve multiple systems, such as cardiovascular system, respiratory system, and GI system. The cardiovascular system involvement is known as the cardiac neurosis. Usually, it causes an atypical chest pain. The respiratory syndrome is also known as a hyperventilation syndrome. And excessive autonomic dysfunction in GI system causes the IBS, irritable bowel syndrome. Next up is the somatoform pain disorder. And this results in pain in parts of the body. And the common type or classic type is the fibromyalgia variant, where there is pain in multiple parts of the body. Another one is the chronic fatigue syndrome, which happens especially after a viral infection. And the patient has excessive fatigue after some or minimal physical or mental exertion. They don't have a good concentration and has sleep disturbance. And the classic infections that typically triggers this chronic fatigue syndrome are the Epstein-Barr virus infection or the flus. Next up is the dissociative conversion disorder. And this is different from the previous disorders because it only involves the nervous system, and the patient have neurological symptom, loss of neurological function that is not explained by an organic disorder. So dissociative conversion disorder is also known as the functional neurologic disorder. And this can involve any system of the nervous system, such as dissociative amnesia, loss of memory, dissociative blindness, loss of vision, functional gait disorder due to an imbalance in the motor function. Then the somatization disorder. Somatization disorder means you have involvement of multiple systems, symptoms of cardiovascular system, respiratory system, GI system, musculoskeletal symptom, even associated conversion symptom. So symptoms of multiple disorders together, when it happens, we call it the somatization disorder. Next is the hypochondriacal disorder, where the patient believes he or she has cancer or another serious disorder. And he goes through multiple doctors, multiple tests, everything comes back normal. And the doctor reassures the patient that you don't have cancer, you don't have a serious illness, but still the patient is not convinced. So the patient has a strong fear or belief that they have a serious illness, and that fear persists despite appropriate medical reassurance. Then the body dysmorphic disorder, where the patient believes that their appearance is disfigured in some way. The body shape or appearance is not normal, abnormal. And that is also known as dysmorphophobia. The body dysmorphic disorder leads to the patient believing this disfigurement, and they usually have request for cosmetic surgery. They visit multiple cosmetic surgeons for apparently normal structures.